This is our Pediatric Sepsis escape room. This is our patient, Chance Liam. This is station 1, where they'll get report and their first set of vital signs. They'll learn about Liam's behavior, his cardiovascular and his respiratory issues, and once they identify the proper Pews score and the interventions using the policy and guidelines, they'll open the blue box. In the blue box is some directions, and they have to pick the proper interventions. They get them right. They get a riddle and some clues to open up number 2. They'll have to assess some urine, which is a mixture of some ginger ale and coffee to make up our colors. And once they're done with that, they will get a clue to open the blue bag, and they'll do the sepsis pathophysiology, fill in the blanks. They'll have a whole bunch of right and wrong answers to fill that PEDS, the sepsis pathophysiology board. There's a lot of discussion that happens here because it's not usually something at the top of everybody's mind. And then once they get that done, they get the code to open the pink. In the pink is orders that they have to prioritize on what order they're going to do it. And then in the green box, so once they get the pink one, they'll get the code for the green gets code for the white gets code for the orange. And all of them have things that they need to do in order to get antibiotics delivered as soon as possible within the 60 minutes. Then they come over here and they play operation to find out where is the proper place to place an IO in a child. If they get that right, they get to the black pouch, which has some trivia questions, which the answers are scattered around the room here with the did you know, over at the first station, and over by Chance, the answers to the Jenga game. Then they have to pull the correct answer out of the Jenga game, and they're kind of all over around. And when they pull the answer out, a letter is on the back that gives them the code. So it's going to spell a certain word, and it will give them the code. And throughout the whole process, they are collecting pictures, which will spell out where Liam Chance needs to go after they have done all their interventions. Then they will stop at my education board here, and we will talk about why the timed intervals were timed for a certain time frame. So they've got 15 minutes to open that red pouch. They have another 15 minutes to get to the white pouch, and then they have 40 to 45 minutes to get to their escape room board. And the reason for that is so that we are timely in our treatment of pediatric sepsis to decrease the child's chances of having a bad outcome. So to do this, we did do some chart audits. Some of the staff took a pre-test. After they're done reviewing everything, they'll scan the QR code right here, and they'll take the post-test, which is the exact same thing, and we do review the answers, so they should all get 100. And they will do an evaluation of this lovely experience. Also did a nice little flyer here on how Pews works with the who, what, where, when, why, and how of Pews. Thank you very much. And thank you to Colorado Hospital Association, who had posted on their website this wonderful escape room scenario.